All right, Mom, so we are here at Howard's campus on the yard.
Yes.
Many times we have been here before over the
Oh,
years.
yes.
And now you are working here. How long have you been working here, and why is Howard ingrained in you so deeply?
Well, Howard is a place of culture, a place of excellence. And I started out visiting Howard, being from the DC area. And Howard it always has excellence and the presence of excellence. And we train and we follow our forefathers. So we have many stars, scientists, some of the top docs for heart surgery, for kidney transplants, Dr. Callinger. There is a lot of talent, and the medical and dental program, particularly the dental school, is very unique in that we educate minorities, and we're a family. We have people from 31 countries, so it's exciting. So there's a lot of history, culture, and we want to build more history and culture through excellence.
I love that. That's awesome. So it's your 4th year?
My 4th year back.
That is awesome. And you're not only are you teaching here and you have a career here, but you graduated from here.
Yes.
So why was it important for you to come back and teach at the place that you learned how to be a dentist?
I graduated twice.
Twice.
From undergrad and the college.
Yes, tell us.
So I wanted to come back because I had a wonderful career in the military, and I've learned a lot about dentistry and the focus and the future of dentistry. And I wanted to make sure the next generation performs at a very high level and knows all about the future of dentistry and how important it is to work hard and to take care of our patients, to take care of our underserved patients who don't have access to care.
Yes.
So not only do we educate at the dental school, but we do mission trips all over the U.S. and even internationally in Jamaica to see the underserved and provide free care.
Which is so incredible.
It provides a base for our students. They see a high number of patients, and then we treat a high number of the underserved and allow them to get some of their dental work done at no cost that they would never be able to do. So I wanted to come back and give back to our wonderful community, as well as make sure that we produce high-performing dentists.
Yes.
And that is what we're doing.
Yes. I mean, you're doing it really well. You've been doing it for a long time, working very hard.
Yes.
What is your favorite part about being a professor and a director of radiology at Howard University?
So my favorite part of my day is working with the students, teaching them the new and state-of-the-art techniques, and then seeing them graduate. Now, we graduate right in this area.
Right here?
Yes. And it goes by quickly. You show them a few things and you see them grow. You see them struggle with the new procedures, and we work hard. We have a lot of mentorship. Howard College of Dentistry and Howard University is a family. So not only do we mentor our students that have all kind of problems, some of them have problems being away from home since they're so far. So we mentor them and nurture them and make sure that they've got the skill set. And then we're here on the yard seeing them graduate.
Yes.
And hearing from them in their new careers is also exciting.
Yes.
And another part of what we do is help build their careers. So we make calls around the country to other residency programs and other jobs, and we get them placed. So we have a great placement. Many of our students go on to be specialists, such as in orthodontics and endodontics and treatment of gum disease, periodontics. So it's just so exciting that they get in these programs and then become the dentist of the future.
That's beautiful. And one of the things that we're talking about in this conversation in particular is that HBCUs, as great as they are, still need funding and still need support.
Yes.
As a person who has received an HBCU education, is now on the other side as a professor, how important is it that we make sure not only that our undergraduate students are able to come through funded, but that grad school programs and doctoral programs are also funded with the same fervor.
Yes, we need financial aid for our students. We need to increase our donor pool. Dental school is very, very expensive, and the students have to live. So it's very important for organizations, for community, for businesses to give to HBCUs, because you're really producing excellent students and excellent professionals that will be all over the world in practicing.
Yes.
So it's very important, and it's very expensive.
So mommy, Dr. Peppers,
Yes.
This is such an important area of education.
Yes.
But how important is it that we fund the graduate schools and the medical schools just as consistently as we do our undergrad programs for HBCUs?
Well, there is a shortage of dentists, there's a shortage of physicians and nurses. So, especially dentists, we need to educate our dentists, and dental school is very, very expensive.
Yes.
Our equipment is expensive. We use 1,000 things, hand pieces, drills, surgical equipment, and it's very, very expensive. So their tuition is close to, on the way to 100,000.
Wow.
It's very expensive for 4 years, and they have to have living expenses too. So we definitely need people to assist us,
Yes.
to help us. We need businesses, donors, to give, to produce, and to make sure that we have enough healthcare providers across the nation to provide excellent healthcare.
Especially, I think, for Black and brown doctors.
Yes,
We need those. I mean, I remember when I left the DC area and, lived in New Jersey and New York, a lot of my friends there hadn't seen Black doctors before in their life. And I really, I'm so privileged to come up with you and your friends, and they were all doctors and lawyers. And, so talk to me about the importance of a new generation of Black and brown doctors for our communities.
Right. We need to, African Americans have the more health problems than anyone in the nation, and their teeth go along with that. So we need to have people that look like them, and it helps them to come out, it helps them to stay in care.
Yes.
So right now, dentists are around 4 to 5% African American dentists of all dentists.
Wow.
So we need a lot to fill the gap. In addition, funding. We need funding to help us, and we need funding and scholarships, because Howard gives students a chance that many other schools would not do, because it's so competitive. If many colleges, dental schools across the U.S. Have 1,000 students in the class size of 100, you have a lot of students who would not get in, and we give them a chance. We start with them early through some of our training programs, and we mentor them.
All right, thank you so much for the great conversation.
It's been wonderful.
Yeah, so we're gonna meet at the Spice Suite in a few, but first I'm gonna talk to Dr. Williams and Dr. Fredericks about this conversation, because I know they're gonna be able to add so much to it. But thank you. You were great, Mom.
Oh, thank you.
Thanks for
It's been
coming.
wonderful.
All right.
Fabulous.
Well, I'll see you soon.
Okay, see you. Bye-bye.